Thank you for joining ALTIUS Answers. ALTIUS Answers really focuses on workforce optimization and productivity, and we are super excited today to have a very special guest on our show, Dr. Cali Estes. She focuses on addiction as well as, the celebrity coach. She serves as a private practitioner and has worked with a broad spectrum of clients. The media has dubbed her Dr. Drew. However, she has actually dubbed herself Olivia Pope from Scandal. And that's really what she considers, her main point is she goes in when there are situations dealing with any type of addiction with someone that really needs help and cleans up the mess. As she has been in business now for about 25 years. She started out as a private practitioner and has now moved into more of a coaching model. She has a Sober OnDemand program, as well as the Addiction Academy, where she trains other coaches how to work with individuals that are addicted as well. So we're going to dive deep today, get into a lot of the nature of addiction, talk about what to do if you, your loved ones, your employees might have an addiction and you need to step in, and just really talk through all the different elements that you might be thinking about. What are the signs? What might you do if you believe you have an issue or someone you know has an issue? So welcome so much, Dr. Cali Estes. It's so exciting to have you here today.
Thanks, Stephanie. I am so glad to be here and be of service to your listeners.
We're happy to have you here. I always like to start by learning more about the individuals that we have on the podcast so that my listeners and the audience at large can really learn more about really what your passion is and where this came from. We all ended up where we are today based off of our past experiences and based off of our passions. So how did you end up in the position you are today? And just walk us through a little bit of what got you to your current role.
So I wanted to be an FBI agent. That's where this started. And I ended up meeting with a female agent. This is back in the early 90s. And she basically said, you're going to fetch drinks and do undercover narcotics. That's about it. And I said, well, it doesn't sound like fun. So I ended up doing my internship in a prison. And I wanted to work, of course, with the crazy guys. This is way before Criminal Minds, way before the BSU. And they said no because I was female. So I got stuck with the addicts and I thought this would be boring. Well, it wasn't boring. It was actually very interesting. And I also learned throughout my studies and my time that I was addicted to food and diet pills. So I was doing this cycle of eating and taking a diet pill and working out. And I tried to break the cycle, normally by the DSM standards, you try this, you try that, and it wasn't working. And then when I realized I was truly addicted to sugar and addicted to diet pills, I started treating myself like I would a drug addict. And this is how you break it, and this is what you do. And I started to learn that the whole just don't do it concept, just be sober concept didn't work for me. And I started studying the body's chemistry. And I started looking for connections. Why does this make you feel a certain way? And as I'm doing it, I learned that it's not just an emotional connection, it's also a physical connection. And I created an entire supplement line called Pro Recovery RX that actually targets the brain, and it targets the neurotransmitters in the brain, and everybody's different. They reach for something different. So if you're reaching for alcohol or Xanax or meth or cocaine, it's very, very different. And as I started studying that, I started utilizing that with my clients. And I learned that I had a higher success rate when I'm helping the chemical and the emotional side together, not just the talk therapy or the coaching, but treating the whole person.
Treating the entire person is so important. I think sometimes in the industry, there's a focus on one component of that aspect and not the whole spectrum, which really leads to some of the dim recovery rates that we have in the United States today. Depending on what you're citing, there could be anywhere from a 40% failure rate to a 95% failure rate on those recovery. And I think it's because of what you mentioned, that we're not treating the entire component and not treating the entire situation.
Correct. And that led me to develop the Sober OnDemand program, which is for my executives and my CEOs and my high functioning individuals who don't want to go to treatment or are afraid to go because if they disclose that they're using, they may be a physician and they're in the ER. And as soon as they say, I'm drinking too much or I'm doing cocaine or I'm doing opiates, all of a sudden they're, under scrutiny under the medical board and they don't want to go. So the Sober OnDemand brings the concept to them. It's very private, very confidential, and we come in for 3 to 10 days and do what a treatment center could do in 30 plus in 3 to 10 days. So it's super intensive, one-on-one, getting to the root cause of the problem, both emotionally and chemically. So it's a little bit of a different concept. And I find that my CEOs, my executive, my celebrities love it because it's very personalized. It's not cookie cutter treatment center where you go from group to group and sit around and complain. It's truly getting to the bottom of what's happening and fixing those issues and moving forward.
You mentioned group therapy and, being in the healthcare industry, one of the things that often comes up is the fact that within group therapy, sometimes you don't necessarily have the one-on-one presence with a clinician, that you have a
Mm-hmm.
lot of individuals that are sitting in the group and they're talking about their experiences. And sure, it's great because you have individuals that, not to refer to them as damaged or suffering, or so they're definitely there, they're trying to heal, but you don't have that one-on-one time sometimes with the clinician or the coach, if you will, that you need to really take your life forward. So that's really, I think, fascinating, the Sober OnDemand prospect, because for an executive or a physician, they really need to feel protected and
Mm-hmm.
confidential, because it's going to be very hard for them to go into a group setting of any type and, number one, show their vulnerability, number two, have faith that it's going to remain confident, and number three, actually share their innermost feelings and fears. So I think that Sober OnDemand definitely works well in, a client like that.
Well, the biggest thing, I worked in treatment for a long time. And when I was a clinician, two things. We would come to work exhausted because we were putting in 60, 70-hour work weeks. And we would sit in the morning and have our morning meeting. And half the time we couldn't remember the client's background and name because we were overworked. Not enough clinicians, too many clients. And the second issue is we had HIPAA, or we have HIPAA. So we're confident, we have confidentiality. The other clients in the treatment center don't. So if a physician is sitting in a group with other people and he says, yes, I'm a physician, I'm a heart surgeon, and three people down decide they want to get squirrely and call the medical board, we can't stop it. They don't have HIPAA. So that's a big deal for a lot of physicians and CEOs. There are a lot of people who run a corporation that say, I don't want people to know I run XYZ. And here I am. And I'll give you an example. Not my client, didn't go to treatment, the CEO of Chipotle. He went out on Long Island and threw a party. And he threw a party, and there was a bunch of underage girls who went, guess what? Facebook Live, here I am, like everybody does. And that happened at 2:30 in the morning. By 4 a.m., the police were at his house, raiding his house. They found cocaine and, of course, underage girls. By 7 a.m., Chipotle fired him. Gone. So this is the stuff we do before it gets there. And that's why I say I'm the Olivia Pope. I come in right around that time before it goes downhill and corral what's happening. And maybe the executive isn't ready to stop partying, but we need to make it so that he's not in the public eye and getting caught doing these activities. So I also do that kind of stuff.
So let's talk a little bit about that and explore that. Sometimes, we've all been in situations where we may have loved ones, employees, friends, parents, et cetera, that we think may have a problem. We're starting to see signs that, okay, maybe they're, slurring their words. Their eyes looked a little bit red today. They may have been dilated. That action was a little bit inappropriate, but yet we don't have evidence, or maybe we simply don't want to believe it. What are some signs that either an employee, an employer, a family member, a friend, a nurse that's working with a physician that's working with a nurse, what are some signs that someone may have a problem?
Change in attitude is the first one. Maybe they're normally easygoing, happy, and all of a sudden they're cranky, or they bite your head off when you ask for something. They seem sharp. So change in attitude, change in mood. The next one is if they're normally sitting at their desk working, they're taking more breaks than usual. They're in the bathroom more than usual. They're in the break room more than usual. Maybe they're snorting cocaine or they're drinking alcohol. Something doesn't seem right there. The next one is they're taking vacation or sick time more often. They're supposed to be at work today and they're sick again. And you're wondering, well, weren't they sick last week, but the same thing they have this week? What's going on? Or they show up late or leave early. They come in 10 o'clock in the morning, they're out by 2, and you're going, what's going on? Why are they not here? If they're working online from home, they're supposed to be on a Skype call, they're not there. Or if they're on the Skype call and it's supposed to be a video, they're only calling in. So there are certain things we're looking for specifically in changes of behavior. The other one would be if they do come in, you'll notice their face is flushed, their eyes are red. If they're doing opiates, they have pin dot pupils. If they're doing uppers, you'll notice they're manic, they're happy, they're excited for 2 or 3 days. And then when the detox, all of a sudden they're tired, they're cranky, they can't get out of bed. So it almost mimics bipolar, and it's consistent, meaning it's not once or twice, because somebody could have the flu, right? They could say, I'm sick, they could call in, they show up, they have bags under their eyes are red, of course they have the flu. That may be a 2-week process. But if 4, 5, 6 weeks down the road, they're still having the flu and they're still sick, there's something going on there that really isn't the flu.
I think in the industry, we sometimes refer to it as presenteeism, where individuals are present, but they're not really there because they may, be hungover or addicted or have something else going on for, days on end. And in our industry, we really can see that as a drop in productivity because
Hmm.
you may have an employee that used to really be able to bang out the reports and get so much done in a day, and all of a sudden it's off 20%. And then it's off 30%, and then it's off 40%, and then they're calling in sick, and then that becomes more of the consistent pattern.
I've also seen it's not just the individual. If they have a family member, like a child that's addicted, their productivity is dropping too because they're so concerned with what's going on with little Bobby or little Johnny or little Susie that they're not present at work. So I call it presenteeism, absenteeism, because you're present, but you're absent. You're absent minded, you're gone. And then they're calling in sick, trying to make sure Bobby's not overdosing or dying, and they don't know what to do. And half the time, it's just as simple as working with a coach going, okay, Mrs. Jones, I'm going to take that stress off of you. Let me take care of Bobby. You go to work, you be productive. I got this. And just doing that, giving, the mother or the father an added layer of help lets them reconvene at work and be present. And we're handling the issue behind the scenes.
I absolutely love that presenteeism, absentism. It's a great way of phrasing that because you have someone that's present, but they're really absent. And I love
Yeah.
that. That's a great model and a great way to mention that. So let's say that you know that a family member and or a physician or someone is showing the signs. What would be the first step that you would advise someone to take? And then we'll talk about in reverse, if it's me
Hmm.
and I know I'm having a problem, what would I do to get started?
So if you're a loved one, the first thing you want to do is make the phone call to somebody that can help you sift through what you're seeing. Because you really want to make sure before you approach your loved one that you know what you're seeing is accurate. You don't want to approach somebody and say, hey, I think you're drinking, you're an alcoholic. If they're not drinking and an alcoholic, they may be diabetic and you don't know. So you want to make sure you have a seasoned, educated professional help you weed through what you're seeing to make sure that is an addiction or it is a mental health issue. That's the first step. From there, we can triage what the best course of action may be. Maybe it's an intervention on a loved one where we come in and say, hey, these are your options, treatment, or you're going to have a divorce, or treatment, or you're going to get suspended from work. We can do that. Or maybe it's as simple as talking to the family and then us having a conversation with the loved one. Because there's a lot of people who say, I wish you saw what was going on and you're missing all the signs. No one sees I need help because no one wants to address it, especially when the person's a C-suite executive. Nobody wants to talk to the C-suite because they could say to you, you're fired. And in certain states, it's work at will. So there's a scared component to it, but we can help you triage that. And someone like me coming in saying to the CEO or COO, hey, this is the problem, this is what we're going to do, they can't fire me. There's nothing they can do to me. And I'm coming in as a professional. And a lot of times they say, I'm so glad you're here. I've
Yeah.
only once had a C-suite tell me I'm not drunk. And of course, I pulled this desk drawer out. It was full of little airplane alcohol vodka bottles. And I said, really? This is like telling the person who wants to diet, who's got chocolate bars in their desk that, they're doing the right thing. And he just looked at me and I said, let's just cut that crap and sit down. And he looked at me and he crossed his arms. He's 55 years old and he crossed his arms. He goes, I hate you. And I said, that's fine. I'm okay with that. Sit down. And he goes, I'll stand. And I'm like, well, then stand. He goes, no, I'm going to sit. And then he sat down and I'm like, you're like a little child. I said, you're throwing a temper tantrum and that's okay. And then he looked at me and he goes, I really hate you. And I'm like, okay. And then he finally opened up. But it took me, who's coming in kind of like the powerhouse, saying, we're not going to do this, but we're going to get help together. I'm on your team. And once I showed him that I didn't judge him or berate him, I was there to truly help him, his walls came down. Because to that point, people had been saying, I think he's drinking, they're talking behind his back. And he knew it was happening, but he put the blinders on and said, I'm just going to pretend it's no one sees it. And I sat him down and I said, here's the problem. Everybody knows. The wife knows, the boss knows, Everybody knows. And you're going to lose your job because you're trying to hide something everybody already knows. So let's fix it. And then when we fix it, you can come back, and the culture and the culture of the company is going to change because you are running the company. And when they come in, they don't want to talk to you. So once we did that and I got in there and we did Sober on Demand, he went back to work and he's like, it's so nice. Everyone was so nice to me. It was nice and relaxed and the energy went down and, it wasn't stressful. I said, well, yeah, we got to the bottom of everything.
Yeah, I think in society today, there's still a lot of stigma around mental health as well as addiction. And so with that comes a lot of shame. So when you're
Mm-hmm.
dealing with executives that, may be aware that they have a problem, that there's a lot of shame regarding admitting that there's that problem. And we don't recognize it as often as we should as a disease that
Mm-hmm.
has a treated pathway that we need to tap into.
I tell most of my clients, you'd be surprised. I have a lot of doctors, nurses, cops, pilots, EMTs, firefighters, and CEOs. Between 40 and 60% of you are using substance, whether it's drugs, alcohol, sex, gambling, internet addiction, shopping. You're all doing something. So trust me, when you're going, I'm so scared they're going to find out, you're all doing it anyway. And when I tell them that, they're like, really? And then some of them will say, well, is there someone worse than me? And I'm like, there's always someone worse than you. Trust me, you know? And then we talk about it and get it out there. And then it's like, okay, let's fix this.
I think that's a great point. We all tend to have some type of addiction, something that we are inclined and, compelled to do more often than we should. For a long time, one of mine was food. And, that's where I would really drown my sorrows. And luckily, I'm moving more towards exercise now. But I think we all have those addictions. And, we all have to understand how to relate to them and deal with them. And I think doctors, EMTs, nurses, executives sometimes are fearful of that component, but like you said, we all have them. So
Mm-hmm.
let's understand them and deal with it. And when we actually start to look at the ratios and the numbers, within addiction, sometimes it's a little bit scary within the medical profession. Depending on what article you read, numbers can be as high as 20% of physicians, providers, doctors, EMTs, emergency department doctors, nurses may have an addiction. Sometimes the number is as low as 1 out of 20, but I've seen it as high as 20%. So the numbers are very high, and there's a lot of reasons. I think sometimes it's because there's easier access to information, and let's face it, there's a lot of higher stress. When you're dealing with traumatic situations, there's going to be a lot of stress that happens with that. And I can't help but at least mention what we're going with today. And this will date this podcast a little bit, but it's March 23rd, 2020. We're sitting in the midst of the COVID-19 pandemic. Across the country, we have physicians, we have nurses, we have EMTs, we have emergency responders, first responders, in some cases that are working 24 hours straight, 48 hours straight. They're seeing things they've never had to deal with. And I think we're going to see some of these addiction situations bubbling up to the surface and mental health situations with post-traumatic stress. Number one, what do you really see with your clients at work in healthcare that drives them into some of these components? And number two, how do you think this social distancing and what's happening right now is going to really, open up further needs in the future?
So the first question, what I'm seeing is there's a lack of quality care. So a lot of people that are EMTs, doctors, nurses, and etc. can only use certain benefits through an EAP, through a specific provider. Well, there's a lot of us that don't take insurance because the pay rate is so low and the work is so high just to get a reimbursable tiny little bit of amount. So we don't take it. So they are only able to see certain people. That doesn't necessarily mean that's the best fit for them. So what I tell my clients is you may have to come out of pocket. You have to find the best fit for you. So if you have PTSD or you have trauma, you have to find the right therapist, not just addiction, but a trauma-informed addiction therapist. And what I see in that population is they see so much more gruesome things. They're seeing more things that are what the average person would call over the top. For example, I have a police officer that's got trauma based upon he came up on a scene and there was a car that had hit a man in a tree, and the man was cut in half, but he was still alive. And he knew once he pulled that car back, the guy was going to die. And the guy knew he was going to die. And there was this conversation for 2 minutes around the guy, getting ready to die. And he wasn't dead because the car was the pressure point. It was stopping specific things. And he had to make that decision to pull the car back. The police officer did, for a humane, I guess you would call it euthanasia, whatever. He had to make that decision. And he was stuck there. And that happened 15 years ago. And he said, I go to bed and I see that. I wake up and I see that. I go to work and I see that. I see that in my kids. He goes, I can't get rid of the vision. And I said, who are you seeing? He said, well, I'm seeing a trauma therapist. And I said, are you doing EMDR? And he goes, what's that? And I said, you've been in therapy for 15 years and never done EMDR? He goes, yeah. So let me get you an EMDR therapist. So I did. He calls me about a month later and he goes, I slept through the night for the first time in 15 years. And it was because he had the wrong provider. Because when you call your EAP, they just give you the top 3, or they say, here, call these people. They don't necessarily vet what you do for them. So what we do is actually figure out who you need. And it may not be us. In this case, it wasn't. I don't do EMDR, but I know some of the best EMDR practitioners on the planet. And I said, this is who you need to see. So that's part of the problem. The second issue is with social distancing. I love the whole medical online community. I love how we're going. For example, if I need to get something refilled, I had this is going to sound kind of gross, but since you guys are medical, you'll appreciate it. I have candida in my bloodstream, which is a yeast infection, which continues to get worse, and I ran out of diflucan. Well, we're amidst the coronavirus. I don't want to go to Urgent Med and ask them to give me a refill. I called my primary, who said we're closed. Good luck. I called my OBGYN, we're closed. Now I'm going, what do I do? So I went online and I Googled online doctor. Went online, sent them a copy of, my prescription bottle, had a phone conversation for 2 minutes with somebody, and bam, my prescription was filled. Cost me $35 plus the prescription. That's phenomenal. So I like the idea of online. I'm online. I've been online with the exception of Sober OnDemand. We do all virtual sessions and have for the past 8 years, because to me, I don't need to be in your space. As long as I can see you and you can see me, we can have a great conversation, and I'm going to give you homework, and you're either going to do it or not do it anyway, and you're going to come to the session prepared or not prepared. So I love the telemedicine, and we're keeping non-sick people out of the ER. I have my husband's aunt. She's the hypochondriac. She's 88 years old, and she's always having a hot flash or a sugar dropped, and she's clogging up the ER. So it's great. We have her now telehealth. If you have something wrong, you get on telehealth and talk to the doctor. The doctor tells her, you're fine. Take this, and all of a sudden she's back in bed and she's fine. That's great, and I love that we're going that direction.
Yeah, I think that what's happening right now with the pandemic and COVID-19 is really going to push telehealth into the forefront. For many years, we've been starting to dip our toes into telehealth within healthcare, but we haven't jumped in and dived in. This is really forcing us to do that. But I think in mental health, more than any other component, it's going to really open up access to care, because individuals, because of the stigma, sometimes wouldn't reach out for help because they didn't want to have to tell someone, I'm going to see the psychologist, I'm going to my addiction counselor, I'm going to get help with this. But now they can just log into their computer and the counselor is there. And I think that's going to really open up access in a lot of different areas. And we work with a lot of rural hospitals and rural communities and see a lot of areas. And I think in those communities, sometimes they don't have a psychologist or an addiction therapist or access. And one of the things we often hear is, well, I want help, or I know someone that wants help, but we're afraid of how much it's going to cost. And I think there's that perception that addiction therapy or counseling is out of reach because it's so costly. But telehealth, I believe, is going to help with that access component.
It is. And we actually have a monthly subscription that people can join, and they can access an addictions counselor or an addictions coach pretty much at any time if they need something. And they just pay one flat monthly fee. And if they want to reach their person, we have an app, and they just tap into the app. I need to talk to, somebody, and bam, within 5 minutes, they have a phone call. We're looking at adding crisis. We haven't done the suicide crisis stuff yet because that's very intensive. But for addiction and mental health, we think it's better to be able to bring those services that you can't get on an EAP, or you have a waiting list. Sometimes there's a wait list to see somebody and you have to wait 2 weeks, and you're going, I don't know how to do that. I need help now. Why do I have to wait? And they say, oh, just go to a meeting. Sometimes that's more detrimental than it is beneficial.
And I can think of, if you take a nurse, for example, that maybe is in the middle of her shift or he's in the middle of his shift, and all of a sudden the stress is getting to them and they're not quite sure where to go, and they have that instinct. They want to go to the bathroom. They want to take a couple pills. They know that they're starting to feel the flu-like symptoms or whatever else, or getting stressed, and they want to just escape that. It'd be so great for them to actually have that access and be able to hit a number, go to the bathroom and call the counselor instead of the alternative, which would maybe crushing some pills or downing a few travel size vodka bottles or whatever it might be. It actually gives them that access to know someone's on demand. So I think that's a
Absolutely.
great service.
Yeah, so that's sort of our answer to the coronavirus, I believe. And I helped a friend of mine has a brick and mortar practice in Wisconsin, and I helped her go virtual over the weekend. And she called me Friday and she's like, I have 4 therapists. I'm panicking. What if people don't want to go? And I said, this is very simple. You're going to send them a video chat. And I gave her my software, and you're going to say, hi, this is what we're doing for your protection. You don't give them an option. You tell them this is what you're going to do and that I'm here for you. So she sent out 350 of these emails on Saturday. She called me Sunday morning and she goes, I got a response from 300 of the people. They were excited to see my face. They were excited to hear how excited I was, and they can't wait for our session. And she goes, the other few hadn't answered. She goes, I got one person who sent me a negative email back. And it basically was, if I can't see you in person, then I'm going to switch counselors. And she said, I said, okay. And I said, see how easy that was. And she goes, oh my God, I'm telehealth. Like that. I said, yes. I said, you are. You're telehealth. And she was panicking. She was going to lose her company. And I said, I think people like online. It's ease of access. You don't have to get in the car and drive. And the last thing you want to do, and this is why I switched from counseling to more coaching, you walk into an office and it says Becky Smith counselor or Becky Smith addictions counselor or psychologist or psychiatrist, you've got a label. People
Yes.
now know you're going there. And if you're a doctor or a nurse or an EMT, a police officer, a firefighter, people are going to look at you and say, oh my goodness, that's my doctor going into an addictions place. I don't want to see him anymore. And then one negative review loses you 40 clients. Suddenly they post something on Yelp that they saw you going there. And next thing you know, you start losing your clients. So being telehealth or being online solves all that issue. It's like you were never there. It's awesome.
Yeah, it definitely solves a lot of issues, both for the individuals that may be experiencing the addiction, as well as the providers that are treating those patients, and opens up access across the board. So I think it's definitely an exciting time within healthcare in this realm, and it's going to open up access to a lot of people that haven't sought care before, or even might need more care than they actually received.
Yeah.
So I
Oh,
want to
yeah.
talk a little bit more. I know that you've worked with a lot of high profile celebrities. You've worked with a lot of high profile executives. You've worked with, some nurses and EMTs, and you've done a lot within the healthcare, areas. What do you think are, some of the most common reasons people come to you, and or, what do you really think you're providing to them that makes you a lot different from, some of the other individuals that are out there? I want to dive into that a little bit, because I really think what you do is very unique. It's a little bit different than the 12-step concept, and just wanted to talk a little bit about your unique approach to counseling.
So I do 2 different things that are very different that the average person, their average counselor, therapist, coach doesn't do. First thing I do is I get to the why. So if you go to treatment or go to an addictions counselor, they're going to treat your addiction. I don't treat your addiction. I treat the underlying cause of your addiction. So your addiction's not your problem, it's your solution to a problem. I want to know which problem is. And people stop and go, wait, what? Because if you go to AA or NA, they tell you your addiction's your problem, right? I say, no, it's not. It's how you're dealing with stress or how you're dealing with PTSD or how you're dealing with divorce or, you're 45 years old, you wake up and realize you hate your husband and you hate your kids and you hate your job and you go, how did I get here? I'm going to take a Xanax and have a glass of wine. We call that the mommy cocktail. And next thing you know, 10 years have passed and you're 55 and you're stuck on Xanax going, I really, really hate my life. Well, the Xanax and the alcohol are not your problem. Your problem is you don't like who you are and what you do, but you don't know how to access that information. So I bring that out and we work on that. So that's what makes me so different. I also specialize in harm reduction, which means you don't have to give up everything right away. That means if you want to drink socially or you want to learn how to drink less, I can do that. If you want to learn how to do less Xanax, I can do that. pretty much any drug except for heroin and opiates. You can't exactly harm reduce those because they're so body oriented and they're so chemically oriented. You have to either do it or not do it. There's no, on the boat or off the boat. Right. So I look at it that way. So a lot of my clients will come to me. I have a lot of high profile men, and they come to me for alcohol, cocaine, and strippers. Those are the 3 drugs of choice. And I'll say, where do you want to start? Because you've got 3 issues. And they'll say, well, I want to do less alcohol or less cocaine or call the escort service less. Okay. Then I say, what does that look like to you? I give them the option to set the parameter. They set the parameter, and then we try to see if they can stick to it. And 1 of 2 things happens. They can, which is awesome, and then we go less and less and less, or they can't. And they come to me and they say, okay, I couldn't do that. So maybe it's too restrictive, or maybe we're not looking at it from the right angle. What are we doing? And we do it as a team. So it's not me sitting back going, how did you feel? It's me sitting back going, what are you going to do? What's the plan? So it's accountability, and it's where are we going? You told me you want to get here and you're here, but if you're not willing to do the work, we're never going to get there. So by getting them to sit down and figure it out with me, they devise the plan, and I'm just their cheerleader along the plan, and then helping them reorganize it if we need to.
That's really, really brilliant. I can draw some parallels to what ALTIUS does with our clients, and when we're working with them on workforce optimization and performance improvement, because if you don't have that end goal and you don't know where you're going, you never can actually have the plan to get there. So you really have to identify, what are you working to achieve? What are those parameters, as you mentioned, and then put the plan in place. And then with the accountability, are you actually doing it? You said you're not going to pick up the phone. You said you're not going to drink. You said you're not going to use the stripper. Have you actually done that? And we do that a lot with our productivity clients, where they might just be working on reducing overtime. It's like, have you actually done that? So without the goal, you can't build the plan. So I think that's really important.
And I have the clients check in with me. So they'll check in twice a day in the beginning. And I had one client, he was so funny. His drug of choice were escorts, cocaine, and alcohol. And he kind of gave up the alcohol. That was easy. So he texts me and he goes, I have a question. And I said, okay, what's your question? And he goes, can I call you? I said, sure. So he calls me and he goes, so I know I'm not allowed to pay for sex because that's escort. And I said, okay. He goes, but got a question. If I fly this girl in from Russia, this is how it started. If I fly this girl in from Russia and I don't pay her, but I give her food and meals and maybe buy her a dress and a purse and nice shoes and, she hangs out for the weekend, is that still me hiring an escort? And I said, tell me where you found said girl from Russia. And of course, it was an escort site. And I said, yes. He goes, damn it. I knew your answer. He goes, but I needed to hear you tell me no. So that's all he needed. He needed me to say, what you're looking at is not in alignment with our goal. Because in his mind, he's like, I could get around the goal this way and still meet the criteria. So I said to him, you have to look at the criteria. The criteria was you don't pay for it. If you're buying purses and you're buying flights and you're buying dresses, you're still buying sex. You're just not giving the girl money. And he goes, yeah, I know. So he has the answer, as do most clients. They just need the encouragement to hear what they know is already valid and somebody to be there when they're weak in that moment. In that case, he was. He's like, I'm ready to purchase this. And I said, no, delete the phone number and move on.
I think sometimes we all need to be called out on our excuses and the way that we try to go around something and get to the end point without actually going through it.
Absolutely. That's exactly what happens. And having that extra support, when you're there and you're in that weak moment. And I tell people, it's like going to the grocery store. You're going to the grocery store and you want to lose 10 pounds. And the first thing you see when you walk in is cake. Every time, cake, cookies, candies, pie. And you stand there and you're like, okay, I'll start my diet Monday. And you put the apple pie in the cart, right? And then you drive up and down the aisles, and the whole time you're going, I really shouldn't get that pie. And then you put the whipped cream in the cart. I really shouldn't get that pie. And then it's the ice cream in the cart. You know what? One more event. I'm going to have one more party of sugar, and then I'm going to go on the diet. If you could call me and go, the cake is in my cart, I would go, put the cake back. You can do this. I'm with you. Go to the yogurt section. Try this. And I would give you suggestions to get out of your head, and it works. And that's the purpose of having a coach or a counselor you can reach, which is the telehealth concept.
Yeah, just put the cake back. Don't buy it in the first place.
Yeah.
So one of the things that you're also really well known for is that you created an addictions academy because you noticed that there were a lot of individuals that wanted to provide coaching services, possibly maybe counselors, but didn't have as much information on serving addicted patients and or helping addiction. And I just wanted to talk to you a little bit about, how did the Addictions Academy start? What do you really do within that academy, and how can people, if they're interested in learning how to train, reach out?
So it started because here I am doing all this work myself, and I would get a client that I would want to hand off to a coach or to a sober companion. And I started Googling and finding out none of these people are trained. So now I've got a client that's high profile that I'm going to hand off to somebody that has no training in addiction. And I'm thinking to myself, what do I do? So it was a necessity. I said, let's start a school where I can train people that I know are vetted, trained, ethically, legally, they know what they need to do, and send them out there and put my name on that and feel confident the client will get those services. So I created the Addictions Academy in 2012, and I started teaching people how to coach. And a lot of counselors came to me and they said, first it was, we're not going to coach. And I said, well, you should, because your success rate's got to go up. And they said, really? So they started learning coaching. And then a lot of people in the 12-step community came to me and said, what are you doing? And I started explaining to them, this is not 12-step. This is completely different. And they started taking classes and they started charging. And then this is amazing. I can help somebody get sober or get the right resources or get into treatment. We have 30 different classes, intervention. We have recovery coaching 1 and 2. We're the only ones to offer level 2, which is mental health coaching.
Hmm.
We have an international master addictions coach certification. We have sex addiction, internet, food, gambling, you name it, we have it. We even go into treatment centers and teach them how to treat their people better and their clients better, to continue the success rate and keep people in treatment longer and see a higher success rate with that particular client. And they can find me at the addictions, it's plural, academy.com. Or if they just Google theaddictionscoach.com and click on training, it'll pop up.
And I think that's so important because, a lot of individuals are trained for the therapy, they're trained in counseling, but there's a big difference between counseling and coaching.
Oh,
And I
yeah.
think that's why the coach aspect, as you mentioned, you have to really be that cheerleader and be the coach is so important. Can you just touch a little bit upon, more, what is the difference between counseling versus the actual coaching aspect?
So counselors go backwards. So a lot of people say, I'm in long-term therapy. I've been going for 2 years. It hasn't really helped. Well, that's because every time you go to therapy, you're going back to a set point in time and you're not really solving much. So I always say coaches are not interested in hearing that Johnny dropped the ice cream cone when he was 8. I don't frankly care. As a coach, I want to know why you didn't do the assignment today. You told me you're going to look for 5 jobs, or you were going to use, less cocaine or less alcohol. What happened that you did not do that today? And a lot of clients that are addicted, they'll say, well, my parents got divorced. It's why I'm an addict. And I'll say, I'm talking about today, not last week, not last month, not 20 years ago, today. So coaching keeps them rooted in today and future, meaning I'm going to hold you accountable. Whereas counseling goes backwards into the gray area of childhood. And I like to go back a little bit to solve some issues, but I really want to see you do the tasks you said you're going to do to get where you want to go. And going backwards isn't going to do that. Going forwards is. So that's coaching.
Yeah, I think that's important because a lot of times we get wrapped up in going backwards and we're always looking at what has happened and we're not focusing in on what can happen. And I think with addiction, you have to interrupt that pattern. So you
Yeah.
have to just stop and interrupt and then move forward because what happened in the past isn't going to matter anymore. It's what you can do to interrupt your decisions today and your decision tomorrow and next week and the month after that to keep moving forward. So it's so important. I think knowing that difference, would cause a lot of individuals to become very interested in the coaching aspect, especially because they want to give back to their clients. They want to help. And if they can add one more tool to the toolbox, it can make
Hmm.
such a profound difference.
And as a counselor, I can go back and forth. So if I'm working with somebody and I'm coaching them and all of a sudden something pops up from the past, I can put my little therapy hat on and go back and work on that issue and then come back into my coaching side. So they're getting the best of both worlds. There's a few of us out there that can do it. Most of the people choose to be just counselors or just coaches. And I tell them both, if you're already a counselor and you've got those 6, 7, 8, 9, 10 years under you for training, add coaching, it's just going to make you more powerful.
I think that's great advice. You don't have to choose one or the other. You can be both, and you can serve a wide variety of clients doing that and have a higher success rate.
Oh, yeah, absolutely.
So, one of the things that I wanted to touch upon is you've written a couple books.
Hmm.
I know that, I think your first book dealt with some personal situation with Married to a Junkie, and you have a more recent book out. When you're looking for titles, do you want to talk a little bit about your passion for those two and what led to them? And then also, really, what you're passionate about right now so that the listeners can really know, what you're looking at, what they should look at, and what they should read.
Okay, so I Married a Junkie. The title came about because during me going into private practice from working for other people, my husband started using heroin, and he was not a heroin addict. He was given an oxy from a friend who said, "Try this, you'll feel pretty good." And he tried it, and bam, he was addicted. And it was right the time period where you could get them for $3 a pill, and all of a sudden they went to 35. And he said, "I can't pay that. I'm going to buy heroin." Then he got addicted to street heroin. He overdosed. He got the car jacked. It was a mess. And one of my competitors found all this out. So they posted online that I'm probably not good at my job because I married a junkie. And because my husband's a junkie, I can't help other people. And when my husband got sober, I said to him, we need to write a book and put everything in the book, the carjacking, the overdose, his criminal record, all of it, and call it I Married a Junkie. And my PR team said, don't do it. It's career suicide. I said, I do a lot of non-conventional things, did it anyway, and it went gangbusters. Everybody loved it because they're like, wow, like you just put it out there. And it's a unique story of how here I am, I'm this clinician with all these years of education and training, getting people sober, and my husband's doing heroin. I can't save it. So it's like, what do you do when you can't save your loved one? You have to hand it off to someone else. And that's what the book's about.
And I think it's such an important book too, from the standpoint that all of us have, people that we know in one form or another that have been addicted. I
Mm-hmm.
think it'd be very difficult for anyone within the United States for you to find anyone that doesn't know someone that's died from an overdose.
Yeah.
Even more importantly, I think it would be difficult for you to find someone that doesn't know someone that's died from a heroin overdose. Just from my experience, I can probably rattle off names of people that I've went to high school with and others that unfortunately were succumb to that. And I think sometimes, again, as I mentioned, there's judgment about it. And I think what was great about your book was, hey, this is a commonly prescribed drug for pain, for people that are going in for surgery, for people that
Mm-hmm.
are dealing with it. And no one's intending to get addicted to it like your husband. You're not
Yeah.
intending to get addicted to opioids when you first take it.
Mm-hmm.
But they took it, and for whatever reason, something chemically within their body, within their makeup, caused that addiction flip, and there you are. And I think that's what was so
Yeah.
great about that book is it's very relatable. I think anyone that has a son, a daughter, a husband, a wife, a friend that's going through addiction and is putting all the blame on themselves and saying, what did I do to cause this, could really benefit from the book I Married a Junkie, because it really puts all that out there.
Yeah. And I'll give you a warning. I do curse like a sailor. So my husband doesn't curse at all, but I'm from Philadelphia and the F bomb is pretty prevalent in there. Um, but I open up with a scene. My dad used to put a gun to my head when I was a child and play Russian roulette. My dad's bipolar. So my background, my home background wasn't addiction. It was mental health. And a lot of people say, oh, you got into addiction because your dad or your mom was an alcoholic. No, I got into addiction because I related to that and it made sense to me. Um, which brought me to my second book. My second book is The 7 Keys to Tap into the Wealth Inside You. And that's based on, I can show you, I have both books. The 7 Key Principles to Tap into the Wealth Inside You is based upon the now what. So now you're sober, but now what? So if we're going through this and we figure out that you don't know who you are, your purpose, your passion, or you have a limiting belief system, or you don't know how to make money, or you don't know how to, create a roadmap. That's what this book is about, how to get from point A to point B. And I was using this with my clients when they got sober. And then I started realizing there's a lot of people that may not have an addiction that also need this type of a roadmap. What do I do? How do I get there? And I've noticed that a lot of the failure to launch kids are reading my book. The kids that are 18 or 19 or 20 who are going, well, I don't know what I want to do with my life. I want to be a YouTube star. And that's their only like goal in life. Their mom and dad are going, you got to read this book because you got to figure something else out besides that. There has to be a backup plan here. So I'm getting that market now too as well.
Not everyone's going to be an influencer or a YouTube star, so you might as well start to look for another career path. But I think with that particular book, the limiting belief concept is so important because a lot of times we all pop up against roadblocks and we don't necessarily understand why we're hitting that wall or why we're hitting that component, and pushing through it and understanding what is the limiting belief that's holding you back is such an important concept. So I definitely wanted the listeners to be aware of those two books because both I think are very important and could be something they'd want to check out separately.
Awesome.
So with that, as we wrap up this podcast, we've touched upon a lot of different areas. You brought so much value as to how to recognize addiction and people that you might be working with. And then more importantly, how can you find help for someone that you love or for yourself and not be afraid to seek out that help? But are there any lasting thoughts you'd like to leave our listeners with that we haven't touched upon today?
Yeah, if you think you or a loved one needs help, call. It's always confidential. That's the first thing. And just ask questions. You don't have to give us the name or where they work or what they do or you. You don't have to say, I'm a doctor at a hospital. Just call and ask questions. This is what I'm experiencing. Do you think there's an issue? And let us help you. We're in the medical profession too. We don't judge. We shouldn't be judging. And we're here to assist you. And if you're at top notch and you're in your top game, you can help other people. If you're only running at 40 or 50% capacity, you're not helping 100% of other people that you're trying to help. So self-care is absolutely important. Your addiction, your mental health, your physical health all take a toll when you're constantly in the grind and the hustle all day long. And especially with this virus, everybody is overworked. We want to be your support team because you're everyone else's support team. Give us a call and let us help you.
I think there's an analogy that's becoming a little bit overused, but I'll share it just for the sake of it. People are referring a lot to the oxygen mask in the planes, and they always tell you that if the plane's going down, make sure you put your own oxygen mask on first before you worry about anyone else's. And I think that's so true here, because if you're not at your best as a physician, as a doctor, as a nurse, just as a human being, you're not able to actually provide for or care for those around you. So you have to take care of yourself first. And this is one of those areas where self-care is so important. So thank you so much for joining today. How can our listeners find you? You already mentioned the Addictions Academy. What are some other contact points for them if they want to reach out?
Theaddictionscoach.com is my personal site. You can also reach me on social under Cali Estes, pretty much everywhere. Dr. Cali Estes on Insta, at The Addictions Coach on Twitter. You can also call us, which is 1-800-706-0318, extension 1. Everything is confidential. We'd be more than happy to help you. If you're calling for classes, it's 1-800-706-0318, extension 2. And we can help you take a look at the classes and see what you're interested in and get you in the right direction.
Awesome. Well, thank you so much, Dr. Cali. I really enjoyed talking today. You shared so much knowledge. And for all of our listeners, definitely reach out if you believe that you or a loved one needs any help with substance abuse or addiction, or if you're a provider looking to simply add coaching to your services. And with that, definitely follow us for ALTIUS Answers on Facebook, LinkedIn, and also make sure you subscribe on YouTube as well as your favorite podcast channel. Thank you again for listening. Catch us on the next episode.
Thank you for listening to the ALTIUS Answers podcast. For more information on anything you've heard today, please search for ALTIUS on LinkedIn or Facebook, or visit us at our website, www.altiushcg.com. That's www.altiushcg.com. Once again, thanks for listening. We hope to see you again in the future.